Kacie, thank you again so much for joining me for a few minutes this afternoon to talk about Community Action, really important agency here in our county that provides a good number of resources that we'll talk about, especially right now during the pandemic and what we're seeing with the economic side of the shutdown, unfortunately. So thank you again. And reminder for folks who are watching here live, feel free to chat in any questions that you may have as we go along. And this will also be recorded on YouTube and Facebook later on. So Kacie, tell us a little bit about Community Action. If there's someone out in the community that doesn't know what Community Action does, what do you share with them?
Our mission statement is that we help people to achieve self-sufficiency and rise above issues of poverty. So in a lot of ways, we have a number of programs, and some that I think that folks don't always realize are community action programs that serve, from expecting women, birth, all the way through to some of our senior citizen populations. We have all kinds of different assistance programs. First, we always start with 211 is out of our office, and that is, you can call 211 to get help. Just call 211. Yes.
Yeah.
And you can get the number for any of our agencies, but as well, any of our, our community partners, it's a social service database. So any kind of challenge that anyone is having, whether that's for utility assistance, food help, if they're looking for, help getting clothes for a job interview or looking for some mental health agencies, we maintain a database that has all of that information and how to access it. So 211 is one of our programs, but, just to kind of name off some of our programs that most people are pretty familiar with, Head Start is one of our programs.
I went and read that Head Start last year. I felt I had no idea there was actually a community action program.
Yes. Well, Head Start itself is such a large program that it's, but it is under our, we talk about the community action umbrella. So it is one of our programs. WIC is one of our programs as well, and that's for pregnant and expecting moms and children from birth to age 5. And that is people I think sometimes think of that as a food assistance program, and certainly there is formula or food packages that people are able to get. But what that really is a nutrition education program. We employ dietitians. We talk about breastfeeding advocacy. There are peer support groups for moms that are trying to make that work. There are, there's just a lot to that, more than just the food or the formula that you get. So WIC is one of our programs, kind of in that same vein. We also have a home visitor program. And that is for new expecting moms, or children from birth to up through to age 3. And I might be misquoting that. But really that allows for someone to come into the home and talk about developmental milestones, with the parents, talk about, when is it time to switch the baby to, from formula only to starting to introduce oatmeal. When should they be able to grab something off their tray? Just things that as a new parent, it can be overwhelming to keep track of all of that. So motto there is kind of like helping good parents be great. And there is some assistance associated with that program as well. We're able to help with diapers, with some of the gear that you need for a new baby, pack and plays, boppy pillows, things like that. There are some things that we can bring as well. So aside from that, we also have our PIP and HEAP programs. Those are separate programs. Yeah, those are both utility assistance programs. And those are very large programs as well. And they're here in our Austinburg Road office. They'll be staying here when our State Road building opens up. So the PIP program is, it allows your utility bills to be income controlled. So you pay a percentage of your income, rather than, if you have that $180 electricity bill, and you're only making, $700 a month, it allows for your subsidize your utility bill, so that it would only be, if it was 10% of your income, it would be $70 rather than $180.
Okay.
So our HEAP program off of that provides a credit to people. It provides a credit on the heating utility, especially through heating season. And that's a very popular program. It can be very invaluable. It does also help people with bulk fuel costs, if that's relevant. So someone that heats their home with fuel oil, or like wood pellets or firewood, things like that, bulk fuel costs. That credit can be applied to those as well. And then that program has our winter crisis and our summer crisis programs affiliated with it as well. So because of the COVID-19 pandemic, our winter crisis program was extended through to May 31st. So we are still able to offer some help with that. And we do have some funding to help with anybody that you don't even have to be disconnected. You can have a disconnect status or just be behind on the bill. Give us a call at 211 and we can get you over to that department and see.
Right, because disconnections were kind of put on a halt.
Correct.
If
Yes.
folks are paying, I'm sure then they still get put kind of into a certain status, and
Yes.
the charge doesn't go away. Then I assume it still.
No, it does not. Yeah.
Are in that kind of boat. I'm sure that's especially with AC, costs and electricity costs right now. So they can reach out to 211, and even if they may think they don't qualify, they actually could right now.
They could, yes. And if someone has had a change in income because of lost in income because they lost their job or were temporarily laid off, if you didn't qualify before, give us a call and see if you qualify now, because that's kind of been what we've told everyone for all of the community action programs, is if you have previously been told that you did not qualify and your income changed, call us again.
So even if folks, and we just had the unemployment numbers come out this morning for the county, just around 1,000 folks unemployed right now. If someone didn't qualify, they made too much of an income because they're unemployed now. Just a quick wide variety of what are some of the services that they could get?
If someone is unemployed, they definitely should call 211 to look into getting onto PIP, because again, that would be, a HEAP payment can get someone out of that disconnect status, or at least get them to the point that they're caught up. And then they can get put onto the PIP program, which means that they're paying a percentage of their income and not their total bill. So that is an immediate help there to kind of reduce the electricity and gas costs of a home. If they have small children, they should absolutely call WIC. That is a program actually that is one of our more liberal income limits anyhow. So if you didn't qualify for WIC before, you could qualify for WIC now. People with very young children, infants to young toddlers, should call our home visiting program. Besides just having that extra help and support, which can be helpful if you're already stressed about money, again, there are some assistance items that are associated with that as well. So that's, we do also have, we have a homelessness assistance program through Community Action called the New Hope program. So if that is something that a family is concerned about, there are some requirements back and forth with that kind of assistance, but we do have people that are very well versed with housing assistance that is available in the county, even if we can't do something specifically.
Yeah, I think a lot of folks, we even got a call this morning here to our office asking where they could get help and assistance, that type of thing, and we directed them towards 211.
Yes, and you should always call 211, because that is, yes.
Could you talk briefly, I guess, even just COVID-related questions? I know 211 is kind of now the direct stop for those questions too.
Yes, so that is if you have questions about COVID. Some of the examples calls we get just are, people have questions about social distancing requirements or the stay-at-home orders, and their various manifestations. If they just have questions about the disease itself or the way that the state has handled it, the numbers of people that have been diagnosed with COVID or that have been hospitalized, or those kind of statistics in Ashtabula County. If you call the Ashtabula County Health Department with those kind of questions now, you'll be routed through to our 211 hotline.
Wow.
We've all received some training on how to answer those questions for folks.
Now, I know a lot of people may think, well, if I have a job outside of the pandemic, but even now, if I have a job, but maybe hours were reduced, for example, we see that quite a bit. A lot of folks, they can't qualify for certain programs because they have an income. But it sounds like almost all of your programs, you can still qualify even with an income.
Yes. Definitely, yes. A lot of our programs we use the standard, the terminology that we use is the percentage of federal poverty guidelines. That is different depending on the number of people in your household. And I think too, and this is, I mean, just a general statement about our community. And I think people do like to be self-sufficient, and anywhere people like to be self-sufficient. They may have qualified all along, because you certainly can have an income. You can be at 125% of the federal poverty guidelines, 150. All of our, some of our programs up as far as like 200% of the federal poverty guidelines. And especially if there's more than one person in the household, or if there are children in the household, I think people would be very surprised to hear what that number actually is.
Right.
If they've had, it may be worth checking in, even if they have not had a reduction in income, if it's not something that they're very aware of. But certainly if people have had their hours cut, if, I know a lot of tipped workers have seen maybe working the same number of hours, but for much less money. If they've had a reduction in income, they should give us a call.
So let's say, someone was laid off and has a child, and they call 211 and they find out they qualify for WIC. So
Mm-hmm.
what's that process? And do they have to come in person to apply? How does that?
So WIC is actually, and WIC is one of a lot of our programs are doing some alternate service providing. A lot of the WIC is easier to get on really than ever right now. We are providing, we are doing the appointments car side. You pull into our office, you call and let us know that you're there. One of the WIC representatives comes out and does all of the interaction with you remaining in your car. The child does not have to be present. I know that's something that people are really worried about. There just are some very basic paperwork requirements, and even those have been scaled back a bit just to make it an easier service to access. So it now is the best time to get onto WIC, because a lot of the things that we were required to do before, we are not required to do right now.
Good. And so have you been, busy in a sense of, have you seen a large increase of clients reaching out to community action? Where's kind of been the need that you guys have seen folks most asking for over these past couple months?
And, I know just from, I do work sometimes as on our 211 line. Food assistance and utility assistance are frequently, frequent needs that we hear about. So we have always been kind of busy, but I think, there definitely has been, we really have been working very hard to push out into the community, especially to folks that might not be used to using any kind of social service assistance, that now is the time to reach out, because we can help. And we have been able to reach some of those people. We've done a fair bit of social media marketing, and a lot of our programs do just a great job of that. Right. So, but definitely, I think the concerns of the community seem to be food assistance and utility assistance. And because, as you said, they suspended shutoffs for gas and electric, but that doesn't change that at some point in the near future that bill is going to come due.
Yeah, no doubt. And that's a nice thing that you guys were available all throughout the shutdown for questions and for people to reach out to. And, one of my worries is now that needs can be even bigger than ever as people start to go back to work, and some of those things are becoming due, and what the different are. So it sounds like really 211 is, as everyone jokes, just call it.
Just call 211 and you can get the phone number for any of our programs. But people, that's really the message that we have been wanting to put out is, now is the time to ask for help. Before the restrictions on, once courts are allowed to evict people again, or once the utility companies are allowed to shut off gas and electric. Now is the time to reach out to get assistance with those matters and to let us help advocate for you, rather than waiting for when you can be evicted again, or when those utilities can be shut off. And certainly, food assistance, and I know that you've been out and about quite a bit in the various food assistance, programs that we have in this county. If you call 211, we work very hard to keep our database up to date on mobile food pantries, spontaneous. There have been just some private or public individuals that have just put together, kind of their own drive We work very hard to keep those kind of things current. So if you need food today and you call 211, chances are we'll be able to tell you, where you'll be able to get it.
That's great. I know, I'm sure your numbers of calls are up quite a bit too, and so people are definitely staying, informed and updated, which is tremendous.
Yes.
So I want to thank you so much for taking the time this afternoon to share about some of these different programs and resources, and want to thank you from myself and from our office for you all staying open, for providing all these essential things to people. It definitely makes a huge difference.
Yeah, absolutely. And thank you very much for the same.
Oh, absolutely. So this will be, again, on YouTube and on our Facebook pages and our Auditor website for folks. If anyone would like to share that with friends or family who may be able to benefit from learning about some of the resources. And as always, when in doubt, call 211.
Just call 211. Absolutely.
Awesome. Well, thank you so much again, Kacie. Have a wonderful rest of your day.
Thank you. You too.
Bye.
Bye-bye.